there are certain compounds within cannabis that can actually have an antagonistic effect, so a blocking effect at that CB1 receptor. So there are cannabis tools that can help with appetite suppression and improving satiety and improving sort of blood sugar and a range of different things there. So the endocannabinoid system is integrally linked to metabolism, not just through those sort of hunger cues, but also through effects at the sort of pancreas and the liver and a range of other areas as well.
Hey everyone, before we get into this week's podcast, we got a pretty cool announcement to make. You are now able to connect with us. We have a pretty cool little widget that's on the website. Just go to paultaylor.biz/podcast. And near the top of the page, you'll see a little icon that says send a message to the Paul Taylor podcast. So what we can do with that, you just click on that and then you send us an audio message and we will get the audio message. Now, the first thing I want to do with using it is actually do an Ask Me Anything episode. So all you got to do if you got a question that you want me to cover is just go to paultaylor.biz/podcast, hit on start the recording, and then send us a message about what you would like me to talk about in the Ask Me Anything and leave your name. We will call it out on the show. I'll get that all put together. And the other thing you can do is just leave us a message about what you like about the podcast, what you don't like about the podcast. Did I talk too much? All of that sort of stuff. And just give us some feedback. And we will use that to continuously improve. So looking forward to hearing from you. Now, on with the podcast.
Dr. Jim Connell, welcome to the podcast.
Thank you very much for having me. It's a pleasure to be here finally.
Yeah, yes, indeed. We've had a few back and forths. Now, I first met you, we had a quick chat at the... Geez, I can't remember whether it was the ASLM conference or the ACNM conference. It was one of the ones for health professionals. And you gave a super interesting talk on the endocannabinoid system. And I thought, I got to get this guy on the podcast because I had a little bit of knowledge about the endocannabinoid system. I obviously know that we have the system. You know, that's what the cannabis, that's how it has an impact on the brain because we have an endogenous system. And I knew it was involved in mood, but Jesus Christ, did you open my eyes to this stuff? So you're a GP, right? How does a GP become interested in the endocannabinoid system to the point where you become an expert and you're lecturing other health professionals on it?
Well, look, it's a very good question. I was a GP, really interested in complex and chronic disease management, managing chronic pain, mental health conditions, or just most patients out there have multiple comorbidities and they can't fit into a particular box as much as we try and make them into one or two diagnoses. Most patients don't really fit into that sort of paradigm. And the conventional sort of tools that I was using, the normal sort of pharmaceutical tools, are really made to treat single conditions and have unexpected sort of outcomes for people who have more complex issues and can often lead to, their own sort of morbidity and their own sort of side effect burden. So I was looking for solutions for my complex patients and who have tried many different things and were treatment resistant in many ways. And I was very lucky to be in a practice back in 2017 where there was actually a very early prescriber of medical cannabis in my clinic. And I was open to it and he showed me how to actually do the application. And my first patient was a veteran who'd, been shot in the Middle East somewhere and had complex issues around pain and PTSD and was really struggling to reintegrate back into civilian life. And it was affecting his relationships and he was, leaning on too heavily on alcohol and we didn't really have anything else to go for. So we trialed some medical cannabis with him, just a balanced oil to try and regulate his sleep patterns. And had wonderful improvements in his sleep, in his PTSD symptoms, improvements in his pain control. And then I tried using medical cannabis with a few other patients within the clinic, and some had profoundly beneficial results, and others had marginal sort of improvements. Others had some side effects without improvements. And I at the time there was no education or training around this medicine, which was very novel at that point in time, and is still quite a novel treatment. And then discovered through trying to understand how these medicines work, the endocannabinoid system. And the more I delved into it, the more fascinated I became, and the more I couldn't understand how this was not the foundational knowledge upon which all other sort of systematic sort of knowledge that we learned through medical school was built. And so I've been, trying to upskill and learn more, and then, from what I've learned, educate others on this really important sort of system, and then how to modulate it to help promote health and well-being, because this is a complex system for complex patients and complex diseases. And that's what most patients really, really are in many ways.
Can I just double click on that, actually? Because you bring up a really interesting point, which I think is a limitation of Western medicine and Western science in general. Because we have this Newtonian, Cartesian worldview in science, where we break things down into its smallest component part, which often necessitates a medical research going down at a cellular level and understanding stuff from that component, which has obviously given us great knowledge. But then when it comes to interventions, I think you alluded to it there, it misses out the fact that we are a complex ecosystem, and that there are very few conditions that just are targeted on one little tiny part of the body. Tell us why you see, you give us your opinion on that, and why there is often so much comorbidities that patients present with.
Yeah, so on that, people are sort of dynamic, constantly sort of changing. So, and most of the receptors, that medications might be targeting, or cells that medications might be targeting, have multiple and varied roles, throughout the body, and and there's a whole bunch of sort of epigenetic and dynamic changes that are ongoing all the time. So to look at something under the Petri dish, at a single cellular sort of model, it's never really going to translate into the complex organisms that we are as sort of humans. And I think a lot of that science, that deep knowledge around what the activity is at a certain sort of cellular level, provides us with some reassurance and confidence when we're using these powerful tools. But whether it is actually telling the real story of what's going on within the body, I think is not necessarily true. From my perspective, in regards to looking at patients developing multiple comorbidities, a lot of that comes down to the endocannabinoid system's role in the progression and the development of disease. And so this is a system that works on regulating our internal environment. It's the master homeostatic regulatory system.
Yeah.
And so as it's placed under increased sort of stresses and load with, deteriorating sort of health, then it becomes unable to keep up with the demands that are placed upon it. And if our main internal balancing systems aren't able to keep up with the demands, then more things become out of balance, and we start developing issues, across other physiological sort of domains, and other things will start cropping up. So I often see, and a lot of doctors would see this out there in the community, that a patient will come in with a particular condition, and they'll be managing for a period of time, and they'll be struggling through, and then something, another factor, another stressor will be placed upon their system, and the straw that breaks the camel's back, so to speak, and then things start unraveling, and their sleep becomes dysregulated, then their mood becomes dysregulated, they start becoming metabolically dysregulated, they start getting sort of obesity, diabetes, and a range of other things. And in my opinion, all of these, comorbid conditions have a central linking system that is, if we can support it and tonify it in a positive way, then we can help across these myriad of domains that are becoming dysregulated.
You just kind of preempted my next question, was, having listened to your talk, my eyes really lit up when you talked about the role of the endocannabinoid system in homeostasis in the body. So for our listeners who may not be well versed on this, let's talk a little bit about homeostasis, because the body's there's so many things that it tightly regulates, right? From our blood sugar to our blood pressure to our pH to our hormones to our temperature. Give people a sense of how important this internal homeostasis actually is. And then the second part of the question is it just the endocannabinoid system that is responsible for running that, or is there a number of different systems that interact with the endocannabinoid system for homeostasis?
A big question and a good question.
It's probably a podcast. I've had an entire podcast on that one.
Yeah.
Right?
So look, the body needs to be finely tuned all the time to make sure it's functioning at its optimum in the environment that it finds itself. And I think there's homeostasis, which is that really tight, regulation of things like the acid base, pH balance within the body, which, if it goes outside of a very finite sort of set parameter, then it leads to catastrophic consequences. I think where the endocannabinoid system sort of fits in is more of an allostatic tool, which is
You just hit on my next bloody question, but anyway, go ahead.
Yeah, so it's the capacity to maintain dynamic equilibrium between, in a state that's constantly shifting and changing, and that needs to occur to allow us to adapt to many different sort of circumstances and environments. If we had to be so tightly controlled that we were only, within these very finite set parameters, we would only be able to live in a very finite set of circumstances. And as we know, humans can survive and in a range of different sort of environments. We have people sort of in outer space. And so we have to be able to continually adapt and change, and it needs to be dynamic. But there does need to be an optimum way that our bodies are responding in all of these different environments. And the endocannabinoid system fine-tunes this process. So it's not evoking all of the change. It's like we have all these opposing networks, a myriad of opposing networks within the body. And so, say with something like inflammation, too much inflammation can cause injury and pain and disease. It also is necessary to fight off, infections and to help with healing and repair and a range of different things. And so the same process can be positive or negative depending on the situation it finds itself. So the body needs to have a sort of a fine-tuning feedback system that makes sure that the body's response is an appropriate one to the insult or the stressor that has been placed upon it. And it's this fine-tuning sort of process is where the endocannabinoid system, is the main process that makes this sort of happen. They've done studies where they've knocked out the endogenous endocannabinoid system or the receptors in mice in the past, and it doesn't kill them. They just have a very miserable existence. They're depressed. They feel pain more strongly. They're lacking in motivation. Their sleep's dysregulated, and a range of different things. So it's the system that helps us reach our best potential in many ways.
Okay. So if we take that into stuff that I'm more familiar with allostatic load, so you talk about allostasis and allostatic load, basically around stress and those chronic stressors that then increase or stimulate adaptations in the body that will, so there's the endocannabinoid system then, from my understanding of what you said, it comes in to help the body to rebalance. And does that mean balancing out at a different level, or is it often trying then to just come back to a natural level of homeostasis?
It's more trying to help the system find or rebalance. So it's the adaptation to the environment, so it's not, if the body's trying to adapt in a positive way, it's not going to say, I'm going to bring you back to what you've always been, because that's where my set parameters are. It is a much more sort of dynamic and intuitive type sort of process. And so it's a cellular communication system within the body that is helping to regulate all of these other intricate processes that we have going on. A good way to sort of try and conceptualize it is, your body is like a complex symphony orchestra. We have all of these amazing sort of pieces playing these intricate and really sort of detailed sort of parts. But if they're doing it out of time, out of sync, all we're going to have is this, horrible and discordant noise. So the endocannabinoid system isn't playing any of those parts. It's there as
a conductor.
It's making sure that they're working together at the right volume, at the right tempo. Each part is playing when it's supposed to, so that we can actually, create this beautiful symphony that we have with this, complex human beings that we are.
That makes perfect sense. And jumping Jehovah, what a role that is when we take into account all the different systems that are in the body. So before we dig into practical implications of the endocannabinoid system, there's different types of receptors. Or I remember from your talk, you talked about CB1 and CB2 receptors. So how do they differ in their function and location throughout the body?
I guess the evolution of our understanding of the endocannabinoid system came from trying to understand how THC, these plant-based cannabinoid, was trying to have an impact on the body and why it was causing the intoxicating effects and the physiological changes that we're all sort of familiar with. And so when they were looking at that process, they saw that THC was actually binding to these receptors, on the cell surface. And the first ones that were found were the CB1 receptors. So the CB1 receptors, the main receptors within the central nervous system and the brain. Like when I first started learning about the endocannabinoid system, I thought, it must just be this minor system. Otherwise, we would have all been sort of taught about it. But the CB1 receptor is, the most abundant G protein coupled receptor within the brain.
Oh, really?
Yep.
Wow.
All of the other sort of 7 transmembrane G protein coupled receptors combined probably have about the same amount as the CB1 receptors.
Which then suggests that it's doing a massive role.
Massive role. It's everywhere, and it's not just on the cell surface. There's, in more recent years, we've found that it's actually intracellular as well, within intracellular organelles and helping the mitochondria like regulate the cell cycle and cellular respiration. So it is not just these interactions between cells, but also regulating things within those cells as well. So it's got an absolutely huge role. But CB1 is predominantly brain, central nervous system, but it is in a range of peripheral sort of organs as well in varying sort of densities. And even though so in all of these different areas, the activation of CB1 will have slightly different effects on where it is and where it's located on that cell, but the aim is always the same. It's to fine-tune and balance. And it does this by having this retrograde signaling sort of process. So normally, most neurotransmitters produced and they're held within a neuron, and then they're released when that sort of impulse to be released occurs, and they have this anterograde sort of activation where they move from a presynaptic to a postsynaptic sort of neuron, activate that neuron, and it causes downstream effects. When that happens, there's a bunch of calcium that sort of goes into the neuron, and that causes these endocannabinoids to be created, and they're created from the cell membrane itself, from the phospholipid bilayer. And then because that cell's been activated, it releases endocannabinoids, and it moves back in a retrograde fashion, and it starts shutting down the calcium influx into that cell and reduces the release of those neurotransmitters. So it's a sort of a local negative feedback system. So when a system is being doesn't matter what it is, really, when it's being overly activated, the endocannabinoid system is trying to sort of tone it down, and make sure that it's not becoming, overzealous and doing its job too well.
That just stimulated a thought. So let's take something like SSRIs or SNRIs. So for the people listening, these are drugs that are used for mood disorders. Because they are having an impact on between the pre and the postsynaptic neuron, do they then influence the endocannabinoid system in the postsynaptic neuron?
Look, I'd say anything that's causing a physiological disruption of any sense is going to be, is going to be affecting the endocannabinoid system, and sort of vice versa. I don't have specific examples in regards to those medications.
No, but it just you just kind of answered my question, because one of my questions was going to be what are the substrates for producing, or the raw materials for the endocannabinoid system. Now you said that in the postsynaptic cell it was the calcium release that stimulates it. But do we know, like for instance, certain neurotransmitters rely on amino acids that we get from the diet? Is there something similar going on with the endocannabinoid system? Like, does it have raw materials that we need to be consuming?
Yeah, really, really common raw materials as well. So they come from polyunsaturated fatty acids, omega-6, polyunsaturated fatty acids, arachidonic acid, derivatives predominantly. So I think one of the issues with the endocannabinoid system was that it was associated with cannabis, and therefore its uptake in regards to general education has been the stigma and the bias of cannabis that has influenced its sort of take-up. It could have been caused an endocannabinoid signaling system or the master homeostatic regulatory system, and it probably would have had some better uptake if it wasn't so closely associated with cannabis. But yes, the precursor essential fatty acids are there within that sort of cell membrane that stimulates the bunch of enzymes that then sort of create these endocannabinoids there on demand as required, and then they're released, they're activated, they're taken back inside the cell, and they're broken down. So it's this, they don't sort of linger and sit around for prolonged periods of time. So it's very specific and targeted to that area of need.
Okay, cool. Very interesting. Right. So let's now get into, that's got kind of a lot of the geek. Sorry, were you going to?
I was going to say, we spoke about the CB1 receptor, but then the CB2 receptor being the other one there, which is predominantly in the immune system. So mainly in the spleen and immune cells. And it's modulating we've got the CB1 predominantly modulating the nervous system, and CB2 predominantly modulating the immune system. But then both of these receptors, the nervous system and the immune system, are in all other organs and tissues as well. And they're often there in sort of varying amounts and varying ratios. These cannabinoid receptors, have different densities in different parts of the body, depending, I guess, on how tightly regulated those systems need to be. But they, the role is generally the same, is to try and maintain balance.
And hence why it has such widespread effects on human health, because it's intimately involved in the function of the nervous system, the central nervous system, and the brain, as well as the immune system, which is pretty bloody significant, right? And you mentioned the mitochondria, because as you were talking about it, I was wondering, just given my very superficial knowledge about the impact on so many different diseases and processes, I thought it's got to be interacting with the mitochondria in some way. Just give out, because we recently did a podcast on the mitochondria and did a deep dive on the mitochondria. So our listeners will be quite familiar with the importance of the mitochondria in both physical and mental health. So talk to us just a little bit about the interactions between the endocannabinoid system and the mitochondria.
Look, I think this is an area that, needs a lot of extra development, but I'm pretty sure, plays the same role as it does elsewhere in the body. And that's to try and sort of help with those adaptations to the mitochondria, to sort of improve the function of the cell, to make sure it's going through appropriate sort of, cell cycle sort of processes, it's utilizing energy in a sort of, dynamic and sort of flexible sort of way. It's an area that I'm interested in, but probably does require a bit of more in-depth sort of research before I can give you a specific answer on that one.
It's just another instrument in the orchestra that it conducts, right?
That's right. And I think, we are sort of seeing how important the mitochondria are in regards to health, disease, sort of longevity and life cycle and metabolic function and a range of other things. So I'm going to have to listen to your podcast and upskill myself on the mitochondrial function.
Yeah, look, it was pretty fascinating podcast. But let's now talk about the impact on our health. So you mentioned the immune system. Just take us on a bit of a deeper exploration of the endocannabinoid system and its impact on overall immune health. And I guess a sub-question is, do we see it playing a role in autoimmune conditions, either the pathology or the resolving of them?
So once again, it's this balance, isn't it, between overactivation and underactivation of the immune system, which is typical of disease. So we've got autoimmune conditions where there's an excessive immune response to non-threatening sort of antigens and cells, and so that's an increase of inflammation. And people who have immunodeficiencies, who can't fight off infections and viruses and different sort of diseases because their immune system is at such a sort of low level. And the endocannabinoid system is really sort of important in that sort of adaptive sort of immune response and the body's understanding what is a threat and what is not, and to help regulate that process, reduce the inflammatory sort of mediators that might be causing excess inflammatory response. So the majority of the time it is an immune modulating sort of experience and anti-inflammatory sort of effect that activation of the endocannabinoid system has. In areas, it's an adaptive response as well, so the body will start expressing more CB2 receptors in the areas where there's an injury to help improve that sort of healing and repair process, so it's not the static thing that's going on. In regards to autoimmune conditions, I think it's incredibly important, not just because of how it affects the immune system, but because of how it affects the gut as well, and does regulate in many ways the function of the gut, the secretion of fluids, the motility, sort of the healing and repair, the actual tight junctions as well. So reducing the exposure to inflammatory mediators that lead to that cascade that lead to autoimmune conditions. So,
and just to clarify or add a bit of depth to that for our listeners, Jim, about 80% of our immune system resides in the gut. And so we know that when you get gut dysbiosis or leaky gut, as people will know it as, that can trigger autoimmune conditions. And so not only is the endocannabinoid system helping to regulate the immune system, but it's also helping upstream in terms of that in protecting, basically looking after the health of the gut. Is that correct?
It is correct. And so there's even an interaction with these, the microbes within the body, and they can produce endocannabinoid-like compounds as well.
Interesting.
And part of the way that they communicate with us is through these endocannabinoid-like sort of mediators. So the ECS is very much involved in that sort of gut, brain, body, access that is being recognized as, I guess, one of the most important sort of access for health and disease there.
Yeah, both physical and mental. I think we're starting to see that gut-brain immune axis is like hugely important. So just stay on the topics of autoimmune conditions then. So has there been any research done on the efficacy of medical cannabis for people with autoimmune conditions? Or is it more for things like pain or inflammation, those sorts of things? I know there's an interaction between those, but
look, from a clinical perspective, and I've treated many thousands of patients, there are different sort of, cannabinoids that can be utilized to really help support patients with pain, with stress, reducing sort of inflammation, and have positive effects on their sort of immune markers as well. There's plenty of research out there from a preclinical and animal study sort of model in regards to the endocannabinoid system and cannabinoids and how they can be useful in these types of conditions, but a lot more sort of, large-scale randomized control trials necessary to give us more definitive sort of data.
But from a clinical perspective, have you seen people with autoimmune conditions that you're using medical cannabis with them having positive effects, and not just on pain, but on some of their symptomology as well?
Yes, I have. Yeah, definitely seen some positive effects. I think there's so many. We're talking about cannabis as a therapy. There's so many different cannabinoids within the cannabis plant, and they all have slightly different sort of effects. And I think we're still scratching the surface of what we can achieve with these different sort of combinations of cannabinoids to be more sort of targeted for certain disease states. So, look, I have seen positive effects. I've seen, people who've had improvements in their pain, their sleep, their inflammation, their stress. But I wouldn't say clearly that, yes, using medical cannabis is a great treatment for, XYZ autoimmune condition, but it can be a useful adjunct for people who are going through those other therapies.
Okay, that makes sense. So let's now turn back to the brain and the central nervous system and talk about the role of the endocannabinoid system on mood and particularly stress and anxiety. Because from our conversation to date, I'm suspecting it's playing a significant role there. Take our listeners through what we know, what's the current state of knowledge in this.
In regards to sort of stress and anxiety and mood?
Stress, anxiety, and mood in general, and the endocannabinoid system and how it interfaces with those things. Yeah,
well, look, it's regulating all of our neurotransmitter sort of function in many ways. There's, these opposing networks, opposing sort of neurotransmitter systems, the endocannabinoid system, especially those CB1 receptors, sort of more dense in certain parts of the brain that control mood and anxiety and the fear response. So there's a high density of CB1 receptors in things like the amygdala and the hippocampus, as well as, the cerebral cortex. So being able to rationalize that emotion to understand whether it's what the appropriate response to that might be. So it is regulating those areas. There's high densities of the CB1 receptors, specifically on the GABAergic sort of receptors, which is the main inhibitory sort of neurotransmitter system within the brain. But also, it regulates serotonin and dopamine, then glutamate as well to a lesser extent than GABA. So it is regulating all of those essential neurotransmitters within the brain that, involved in that stress response. But the stress response is not just occurring within the brain. There's the parasympathetic and sympathetic sort of nervous systems being involved, and there is a high density of CB1 receptors in the vagus nerve, and also
interesting
in the paraventricular nucleus, I think it is, around the area that sort of is where the cortisol or the precursor sort of hormones that release cortisol that act on the adrenal glands, and the endocannabinoid system is involved at all of those parts of the pathway. But one of the things I think with depression is that we're starting to realize that it's not necessarily a deficiency in serotonin that is
I think it's now. I actually interviewed one of the authors on that seminal paper that completely debunked the serotonin theory of Mark Mattson. Actually, I think he presented at the same conference we were at.
Okay. All right. Unfortunately, I didn't get to go to as many talks as I would have liked at the conference, but there was some fantastic speakers. But I think what it really is, it's the capacity for the brain to sort of adapt and change. So to create new pathways and memories and neurogenesis around that sort of hippocampal regions of the brain. I think that's one of the key features of depression is there's an inability to create these new pathways. And the endocannabinoid system is heavily involved in sort of neuronal plasticity and synaptogenesis and neurogenesis as well, and creating those new sort of pathways. So it is strongly linked to these, to mental health conditions.
I remember just when you said that about neurogenesis, I remember years ago, and I'm very, very light on the detail because I read a research paper years ago showing that people who had recreationally smoked cannabis seemed to have less Alzheimer's disease, and they thought it was because of the impact on neurogenesis. So does medical cannabis then have a positive impact on neurogenesis, or is it a bit more complicated than that?
Look, I believe it can, have a positive impact on sort of neurogenesis when used appropriately. But if people are abusing, high concentration THC and dysregulating
like anything,
their
right?
bodies,
There's limits. There's limits, and it's like many things that come into the body. There's Goldilocks effect, right?
100%. Yeah. So it's all about finding the sweet spot. Especially with THC, which is one of the most powerful, but also one of the most risky sort of cannabinoids within the sort of cannabis plant, and it has a lot of direct activity at those CB1 receptors, and so through that can have powerful positive change if used at the right doses in the right patient. But if overused and abused, it can lead to further dysregulation of an out of balance system, which is going to be negative. But the compounds themselves can have, neuroprotective sort of properties and anti-inflammatory and antioxidant sort of properties as well. I think, there's been some observational sort of studies that have shown that people who have had head injuries while using cannabis may have been more likely to have that head injury because of the cannabis, but actually had better
protection if they do get it.
Better outcomes than, say, if someone was just using alcohol without the sort of combination of the two. So reducing the insult to the brain that occurs through those traumatic sort of injuries. So there's a lot of signals to suggest that, yes, cannabis could be utilized if used appropriately to help people with, neurodegenerative sort of changes and improve brain function in those types of conditions like Alzheimer's.
Interesting. You mentioned there particularly about THC, right, which is the one that when taken in excess can have negative effects. There's this, and I'm not sure whether there's research on this or it's maybe just your opinion, but we know that the cannabis that's available these days has got much, much higher THC concentrations than when me and you were youngsters smoking the odd joint, right? Is this the driver of the increased risk of psychosis that we see, particularly with teenagers and cannabis? And by the way, I'm not suggesting that all teenagers with cannabis can develop psychosis, but it does seem to be a significant risk factor, both psychosis and schizophrenia in teenagers who start. And is that because of the developing brain? So two questions. One, is it the THC concentration that's doing this? And B, why teenagers? Is it because of that there's so much development happening that disruption of the endocannabinoid system can have widespread effects?
Really good question, and one I'll be doing a podcast on soon with a psychiatrist myself, actually. But
cool.
Look, the endocannabinoid system is so important to the maturation of the brain, and the brain in males doesn't stop maturing till the age of 25
or 65 for some people.
Yeah, well, some people never get there at all, but women it's a bit earlier, around sort of 22, that kind of age, and so this, like, the optimization of the endocannabinoid system through this time is incredibly important to make sure that all the neural networks and pathways are at their best, and it sets us up for life through this sort of period. It seems like there's lots of conditions that have, at their core, a dysfunction of the endocannabinoid system. My theory, and this is just my theory, is that, people who are sort of, who are prone to developing a psychotic illness or schizophrenia likely have a dysregulated endocannabinoid system. Many of them will
to
have
start off with, right?
Many of them will have,
because it's the master regulator of so many things.
That's
particularly in the brain.
that's right, and it's regulating a lot of those dopaminergic sort of systems and other things that are going on there. And so a lot of people will develop a prodromal illness. So they start, might have some social isolation, stress, anxiety, depression, these types of things that are happening before they develop a florid sort of psychotic illness. And at that point in time, if things are, if they're engaging in, really great behaviors around sleep and stress reduction, and they're probably going to rebalance their system and, prevent themselves going into that more chronic sort of psychotic illness sort of state. If they find something like cannabis, which a lot of them will be experimenting and self-medicating with a range of different sort of substances, and they find it's beneficial for a lot of those things, unfortunately, we don't have the cultural sort of wisdom and guidance to help these teenagers understand that there is that Goldilocks zone. That a small amount can be really profound and powerful and beneficial, but too much of a good thing actually is going to lead to negative health outcomes. So I think a lot of them use more and more cannabis because they think that it's helping.
They get an initial benefit, right? It feels good, so the theory is more should be better, right?
More should be better. They use more, and therefore they actually start dysregulating things further, and then they're more likely to promote those symptoms or the dysfunction within the brain that leads to the psychosis and those sort of symptoms. So there is a correlation with the increased overactivation of those sort of receptors with higher concentration sort of THC products, things that aren't sort of balanced with CBD and other neuroprotective sort of, cannabinoids is more likely going to, lead to more psychosis.
And now I'm aware that we do have limited time because you have to get onto it. So anybody who's ever smoked a joint will be familiar with the munchies and some forgetfulness. You mentioned earlier on the impact on the hippocampus and hence then the inability to form memories or forgetting or recall those memories. So talk to us about the role that it plays in eating and hunger and then potential uses of the endocannabinoid system in this area.
Do you mind if I could just go one step back in regards to the forgetfulness? And most of the time we sort of think of the forgetfulness, that might come when using something like THC as a negative sort of side effect. And for a lot of people, that's the case. But for patients who are re-experiencing sort of trauma in PTSD, the forgetting of these negative experiences can be really powerful. And in a condition, there's some evidence or some pretty good evidence to show that there's a dysfunctional endocannabinoid system in those who have autism spectrum disorder. And one of the things that I see that's the hardest thing for many people with autism to deal with is the excessive overwhelm and overload of a whole bunch of information that they just don't need, that they can't get rid of appropriately. So they're remembering, all these insignificant, not always, but a lot of different sort of, events or occurrences or details that just aren't actually helping them sort of function. And that leads to complete overwhelm. And the inability to forget these things is actually what's causing the dysfunction. So that forgetting nature is really important in health as well.
And I think important for a good functioning brain on a daily basis because we are bombarded with so many bits of information, right, taken into the brain, and it can't process all that shit.
That's right. So we need to get rid of the stuff that doesn't sort of serve us, and we need to be able to hold on to the things that are important. And if we are, scared or traumatized, we need to have appropriate ways of extinguishing that sort of fear response. Otherwise, it can, lead to sort of issues as well. So I just wanted to make that comment on memory and forgetfulness. But there are other cannabinoids that can actually help with memory. But moving on to the munchies, so the classical munchies, and that is that CB1 sort of activation at different parts of the brain. But there's also other, things that occur there from a metabolic sort of perspective. So there are certain compounds within cannabis as well that can actually have an antagonistic effect, so a blocking effect at that CB1 receptor. And so there are cannabis tools that can help with appetite suppression and improving satiety and improving sort of, blood sugar and a range of different things there as well. So the endocannabinoid system is integrally linked to metabolism, not just through those sort of hunger cues, but also through, effects at the sort of pancreas and the liver and a range of other areas as well. And it actually looks like people in an obese state have excessive production of endocannabinoids. So partly there's a dysregulated endocannabinoid system there. So rather than it being low functioning, it's over functioning. There's probably an excessive amounts of omega-6 essential fatty acids through, all of the vegetable oils and these types of things that we're getting through our packeted sort of food sources. And so that's putting people into a continual sort of state of being in permanent sort of, having the permanent munchies, and can lead to...
And does it interact with leptin at all?
It does, yeah, very much so.
That makes perfect sense, right? Because leptin is involved in cessation of eating as well as voluntary physical activity, right?
That's right. So yes, that's one of the main key hormones that it's interacting with to drive this sort of feed forward sort of processes around sort of hedonistic sort of eating patterns that we're often seeing. So yeah, the modulation of the endocannabinoid system through obesity can be really, really interesting potential sort of treatment for many people too.
Yeah, I can see just from this conversation and from your awesome talk that you give why you're so excited about this. And it must be like, as you get into this, every time you turn over a rock, there's like a whole ecosystem under there to explore. So tell me, what are you excited about cannabinoid research going forward? Because the potential here, given the widespread effect that the endocannabinoid system is having on metabolism, immune system, nervous system, it's got to be so exciting, the potential research, but also difficult to do and probably going to take a long time, I would imagine.
Yeah, look, and the incentives, I guess, for people sort of, studying naturally occurring compounds that can't be patented is often lacking when a lot of these trials cost millions of dollars. But the thing that really excites me just from cannabis in general is that we have a complex tool to actually better treat complex conditions or patients with multiple sort of comorbidities, because cannabis is not a panacea in any way, shape or form, and it's not always the most powerful treatment for any one particular sort of condition. But if someone has 5 different sort of ailments, they're struggling with sleep, they've got pain-related issues, digestive issues, anxiety, stress, whatever it might be, it might improve each one of those, 10, 15, sort of 20%. And improvement across multiple domains can actually lead to significant improvements in quality of life. And so therefore, you've got less barriers that are stopping people from engaging in a whole range of other health promoting activities. And you're giving them better opportunities to do more exercise, to have more meaningful social connections, to, be more engaged with their family and their children. And all of this has, it's the combination of, reducing the symptomatic burden, but then getting them to engage in a whole range of other activities that naturally support and upregulate their endocannabinoid system and bring joy to their world. They can have long-term, profound, beneficial outcomes.
Gateway effect, right? You're talking about a classic gateway effect where it has an impact that then opens doors or gates to lots of other behaviors or impacts.
That's right. It should never be, like cannabis prescriptions should never be done, on their own. Just people providing cannabis access, I think, is completely inadequate. And, there does need to be a whole lot of education and support and guidance to create functional and personalized sort of goals, that people are sort of working towards to better their health naturally as well. But I also think there's a whole, like I said, there's hundreds of different cannabinoids out there. They all have slightly different effects. We can create more specific and targeted medicines for different conditions, down the track, and reduce the amount of THC that people are using as well, because even though that's a powerful medicine, used in high-risk individuals or the wrong amounts, it can be sort of problematic as well. And it's an outlier. It's very much an outlier in the cannabis plant in that it's the only really intoxicating sort of compound within cannabis. The rest of them work through so many different sort of mechanisms of action, but they're generally very safe and have more side benefits than side effects, which is hard for many medical practitioners to think about, because we always think of drugs that work across many domains as being dirty drugs or causing a lot of increased sort of side effects. And we just don't sort of see that with cannabis and, and other herbal medicines in many ways too.
Jim, sorry, I could continue this for you just because it's so interesting, but I know you do have to go. So where can people go to find out more? So whether it's a GP that wants a bit more education around this, or just whether it's individuals, where can they go to find out more about you and what you do and the Heyday Clinic and stuff like that?
Yeah, so look, in regards to sort of myself, we've got a website, heydaymedical.com, and that's, puts people in contact with our sort of doctors, but there's also different blogs and information there around the sort of endocannabinoid system. For prescribers, I've put together a lot of prescriber education sort of tools. Like I said, we have our own sort of podcast that's only allowed to be sent to healthcare professionals because otherwise it's seen as advertising here in Australia. But there are many, many great podcasts out there. Curious About Cannabis is one, it's a US-based podcast that I got a lot of really good information out of myself. There's a couple of, North American clinicians that have, YouTube videos that are very informative as well. So people like Dr. Dustin Sulak and Dr. Bonnie Goldstein, as well as Dr. Ethan Russo. They, have been working with these medicines for a long time and are very much holistic in their approach towards prescribing cannabis as well. So look up some of those OGs if you're wanting to get some more information.
Awesome. Jim, thanks for your time. That was bloody awesome. It's really opened my eyes to a pretty bloody important system in the human body and the human brain. So I will be going and exploring a little bit more for one. Thanks, Jim.
Cheers, Paul. Hopefully we'll do it again sometime.
Indeed.
All right. See you, mate.